5 weeks into a partial government shutdown, and the impact is really hitting some of the country's most critical agencies. TSA screeners, Coast Guard members, FEMA staff either working without pay or forced to stay home. Now a major federal employee group is sounding the alarm, warning that this could impact national security and travel, as we know all too well here. Joining us now is John Hatton, Vice President for Policy and Programs for the National Active and Retired Federal Employees Association. So John, that line really stands out. Federal employees cannot be expected to work indefinitely without pay. How close are we to that breaking point?
I think we're already seeing cracks. You're seeing people quit. I think more than 360 or about 366 people quit already. You're seeing higher numbers of call-ins for being sick, up 30 to 50% according to some agencies. So you're seeing absenteeism rise. That's going to impact services. You're seeing TSA wait times increase. You're seeing President Trump calling in ICE agents to provide operational support for TSA agents at certain airports. So you're seeing the cracks already. Ultimately, people work and do a job so they get a paycheck. These aren't volunteer positions, and so that's, you cannot expect somebody to continue working, week after week after week, month after month without getting a paycheck.
So the union sent this letter to Congress. What pushed your group to actually send this letter now?
It's been way too long. We sent a letter at the beginning. I think things are starting to reach a breaking point where you're getting to, closer to the second full missed paycheck, where they already missed two, one partial, one full. And it's, we're coming up on a potential congressional recess over the Passover and Easter holidays. We just think it's time to really buckle down and get a deal struck on this. And if you can't, at least fund the agencies like Coast Guard and FEMA, where there's no dispute over, what the final numbers are going to, what the final authorizations are going to be. And if you can't do that, at least pay people while they're.
So at what point do you think this shifts from a political stalemate to a real public safety concern? Do you think we've reached that point?
I'll leave that to that's on, how many people need to be staffing these agencies. I hope they'll ensure that there's going through security or adequately screened in this case, or that the Coast Guard operations are occurring to the level they need to. But the first results are going to be much longer wait times, severely disrupted air traffic, some of the background type of operations where people start quitting really critical security roles. Then you get, but when is hard to say, and I think it really depends on, do people working in these jobs see a light at the end of the tunnel where they actually will get those paychecks.
And so you're calling for funding non-controversial DHS functions. What does that actually look like? What does that include?
Well, you'd split out Coast Guard and FEMA and TSA and anything else that's not the ones in dispute where they're negotiating over conditions and details of ICE and CBP funding. And so, you could easily separate those parts of the bill out and pass those separately. And certainly there's been calls to do that. There's efforts to do that. There's not consensus around that. I think, that might make it harder to reach a deal on the CBP and ICE funding. But at this point, it's been, we're going on fire. I think it's time to just bite the bullet and get those on and see what you can do on the others.
An ICE detention facility set to open soon in Social Circle and another announced for Hall County. We wanted to dig into a new article this morning that's posted on healthbeat.org titled "How ICE and Hospitals Are Failing at Infection Control." It details growing concerns about infectious disease outbreaks inside ICE centers, and experts say the risks could be getting worse. Joining us now is Dr. Jay Varma, a physician and public health expert, also a contributor there at HealthBeat. He wrote that article. So, Dr. Varma, it's great to have you and your expertise this morning. Good morning.
Great. Thanks for having me.
So, how serious is this risk of outbreaks inside some of these ICE detention facilities?
Anytime you bring together a large number of people from different settings into a closed environment, you run a risk of diseases being transmitted. And, ICE facilities are particularly high risk because they are extremely crowded. You have people that have come from, who may not have had access to standard vaccinations or other health interventions. And so it's really important for the health of the people that are there, for the health of the people that work there, and of course for the health of the surrounding community to make sure you can do everything you can to prevent outbreaks in these places.
I'm glad you mentioned the surrounding community here because I want to take Social Circle as an example. We have this ICE detention facility set to open in just a matter of months at this point, and it's going to be a large one, up to potentially 10,000 detainees, I believe your article stated. So if there were an outbreak there, what would that mean to folks who just live and work in Social Circle?
Yeah, well, obviously, these places don't exist on another planet, right? They exist in our local community. So you're going to have community members who either work there, whether they're officers, whether they're part of the support system, and also the people who work there who are moving in and out are going to go to restaurants, they're going to use the health facilities, they're going to have kids in schools, et cetera. So you can never wall off a facility, even when it is something as, secure as a detention facility. So I think it is important for the people of Social Circle to consider, all of the implications of having a facility like this there. And one of those is the risk that if they don't do the things that we know that are important to control infections in there, that it could potentially represent a threat to the community.
And Dr. Varma, what kind of health risks are we talking about here? What kind of outbreaks?
Yeah, so we're mostly concerned about diseases, bacteria and viruses that travel through the air. So the ones that we've seen most commonly that have been documented in ICE facilities so far are, we're seeing a resurgence of measles here around the country. And it's just another important message to people out there to get your kids vaccinated and get yourself up to date if you can. But measles is one of the most contagious viruses that exists. And so that's why you're seeing a lot of these infections spreading in health facilities. We're also seeing outbreaks of a disease called tuberculosis, another respiratory diseases. And then, of course, some of the standard ones like flu and COVID. So the ways to prevent this are really you have to decrease crowding and you have to improve the ventilation and filtration systems. And you also have to get people vaccinated. And these things require effort. And of course, when you have a big operation where you're trying to bring a lot of people in, very quickly, like the current administration is trying to do, some of those procedures may fall by the wayside.
Yeah, I mean, you write it in there and you laid out some solutions just now, but you also write in your article that the solutions are not complicated. If they're not complicated, why do you think we aren't doing them?
Well, I think it's like anything else, when people prioritizing, right? Law enforcement officers, they're really prioritizing, can we get people into detention, keep them there, and then, have them go through the legal process? And a lot of times they're not thinking about the health implications. And I think one of the things there are, two important points to make here. I know some people, may not feel a lot of sympathy for people that are in, these facilities or in prisons, but we have to keep in mind, the penalty for violating immigration law or violating a law in general, it doesn't include getting tuberculosis, right? So at a very basic human level, that's important. But even if we think about it in sort of a more selfish or self-centered way, it's important too, right? We want to keep ourselves healthy. And when you have diseases that transmit through the air, anytime we share that air, we're potentially at risk. So I think it's just a question of prioritization, right? Right now, their priority is detain as many people as possible. And I'm not here to discuss the politics of it, but I just want to, highlight for people that you also have to do that in a way that is safe for the people there, the people that are working for them, and of course, the community that is going to be the host to these facilities.
Dr. Varma, in your article, you also write about hospitals falling short on infection control. What do you see in there when it comes to hospitals?
Well, the same type of thing can happen also in a hospital as well, right? Hospitals are particularly risky because, they bring together people who are very vulnerable, right? You have people in a hospital that are sick already, so they're vulnerable and at risk of getting sick. And then you bring together people who may already have a respiratory infection. And, the thing about hospitals is they do invest in infection control, right? They try to screen people for cough. They may use masks. They may use isolation rooms. But the risk is so high. So it's even higher than you would have, say, for example, in an ICE facility, that you have to invest more in it. But from a hospital's perspective, that's not necessarily paying the bills, right? Prevention, security, insurance, these are all things that a lot of us, in regular life view as sort of luxuries, after we take care of a day-to-day basis. And we know that a lot of hospitals are struggling. There's been cuts to health insurance. And so when you're going to make savings, they tend to not invest as much. And what we're seeing is that a lot of the people that are focused on infection control, they're reporting they're just simply not getting the resources that they need to make sure that these facilities are as safe as they need to be.
Dr. Varma, your final message this morning to folks out there who might be interested in better protecting themselves.
Well, I think there's 2 or 3 really important points. The first most important point is a lot of diseases have vaccines that are safe and effective. That includes like measles, we're at the tail end of the flu season. So get yourself and your kids vaccinated, number one. Number two, think about ways to improve indoor air quality. This is something we learned during COVID. It's not just for preventing infections. If you have an air filter or you're keeping your windows running, I know there's a lot of pollen issues, obviously, this time of year in the South. Air filters, things like that can really help with cleaning up pollen. And the third is, think about the facilities in your community. And if you go to a hospital or you're going to somewhere else, ask, be an educated computer. Say, hey, what are you doing to make sure that there aren't infections being transmitted here, especially if a loved one is being in the hospital.
How do you avoid getting stuck in those long lines or worse, missing your flight altogether? So how early do you need to get there and what can you do to avoid missing your flight? Let's talk about it all this morning with Montre Waiters from AAA. Montre, glad to have you on as always. So we just saw a live shot from inside the airport. People are waiting 2, sometimes 3 hours. Is this the worst crisis we've seen? Or how does this stack up in terms of problems in the airline industry?
Well, yes, I think this is one of the ones that, we're kind of like, oh, God, this is a lot going on, but bottom line is, spring break travel is here, airports are crowded, they're going to have to expect longer security lines, especially as TSA staffing issues continue at some locations. So it's very important to make sure that you get there early, check your flight often, and give yourself extra time to avoid missing your plane. You talked about that 2 to 3 hours. Actually get there at least 3 hours prior to your flight time.
Yeah, better to be early than just be cutting it close. As we've heard, some 36% of TSA workers here in Georgia and Atlanta are calling out. So, Montre, is this more of a spring break problem, or is this something that we might see really heading into the summer?
Well, right now it's too early to tell. We're looking at there being a spring break problem, and hopefully once spring break starts to die down, we'll see those wait times kind of, decrease. So we're telling travelers, look, check TSA wait times before you leave, right? Use the airline apps for real-time update. If you can, check bags. Make sure you book parking ahead of time as well. And, let me say this too. Pack your patience. Lines may be long, but everyone is doing their best, and a little kindness goes a long way. Those TSA staff, they don't control the crowds. Patience helps everyone. Taking a deep breath and staying calm can move things along. So it's all about packing your patience.
Yeah, we all have to kind of just keep it cool. I was talking to some friends in Houston where some 50% of TSA workers have called out at one of the airports, so it's even slower there. But in Atlanta, do you think we have it a little better here considering we have multiple checkpoints and, we have what many call the most efficient airport? So do you think it's better here compared to some airports?
Absolutely. It appears that way. And again, because of how Atlanta Airport is structured. And again, but even with having, the best structure airport for people to get through, it's still important to make sure that you get there early.
Okay, so besides getting there early, which we all need to do, is there any other advice you give to travelers if they're heading to the airport? Because some people, they may not be used to this. Some of us travel often. Some people, this might be just, a rare spring break trip they're taking, and it really catches them off guard.
Absolutely. Again, that's why it's very important prior to getting to the airport to make sure that you check the wait time so that you can know what you're dealing with, and keep your eyes open and, use those airport apps for real-time updates. That helps travelers tremendously.
One more thing. I also am seeing that people say the morning is probably not the best time to travel. And so would you recommend, or at least from what you're seeing, does it seem maybe like an evening flight or maybe a midday flight might be better in terms of the wait times?
Well, actually, what we've been seeing is early morning travel actually is a better time to travel Second, you would say later in the evening. So maybe later flight anytime after 6 o'clock. It's really probably that maybe 10 to 6 time period that's really, really hard on travelers.
Yeah, we've seen the wait times, at least at this point this morning, be around 2 hours. Some people have told us that when you go in the midday, there seems to be sort of this lull, but like you said, you just never, ever know. Any more advice, though, Montre, before we let you go, that you want to let people know about before they head out? Because we could be in this for a while now.
Well, bottom line is I'm going to say it over and over again. Make sure you pack your patience. And definitely for those that are driving to the airport, I know that we suggest 2 to 3 hours ahead of time, but also consider that if you're driving to the airport, we're here in Metro Atlanta, there may be traffic delays as well. So, maybe think about actually adding an extra hour onto the 3 hour.
A new poll shows that 95% of voters believe that hunger is a nonpartisan issue and requires collaborative solutions. But with changes to SNAP benefits, more families now turning to local food banks for help. Let's bring in Kenneth Hill now, the Chief Supply Chain Officer at the Atlanta Community Food Bank. Kenneth, great to see you this morning.
Good morning, Dan.
Thank you for your time. I want to just start off, first of all, what is maybe the biggest change you're seeing right now when it comes to demand at the food bank?
Well, the demand is always great, but we're always faced with, every time it's an increase in household costs for families, it drives the food budget to a smaller portion of what they have left. And with gas prices, with housing prices, the budget is not flexible in those areas, but people have to make the adjustments in their food. And that's where the food bank comes in to fill that gap.
Well, I'll ask about SNAP in a minute, but since you mentioned gas, have you noticed more families coming in asking for help since we've started seeing prices get closer to that $4 mark here in Atlanta?
It's absolutely making an impact. And you can't bargain at the gas pump. You don't get to choose to pay a lower price. It just means less money for you to go and buy food for your family.
And what does that mean for you all? I mean, working with the supply chain, trying to get trucks, moving around across the city, and you're paying diesel. How are these prices impacting you right now?
Well, right now we're trying to mitigate that cost. We have to get the food in. We don't have the option to delay anything because demand is rising. So it just causes us to pull on other resources to make sure that the supply chain continues to flow from our farmers and our producers in here to the food bank, so that, again, we serve our neighbors who really are feeling the pinch.
Okay, let's talk about SNAP benefits now. How have these changes affected families who rely on your services?
Well, the proposed changes could be very significant because that budget that SNAP provides for families who are most critically reliant on support, when that goes away or the requirements change, you have whole swaths of our population of people who are already food insecure who lose the benefit of the biggest hunger fighting tool that we have in this country.
So what's the solution? Can you tell me where Feeding America comes in, for example?
Yeah, absolutely. Feeding America is working across the 200 food bank network to make sure that we are getting the food that we need to make sure that we can better serve those neighbors. Now, we can't backfill the gap that SNAP would leave if it's diminished. That's too big. But what we are doing is partnering to make sure that we're advocating with our government at the local and the national level, those leaders, to make sure they understand that. And then we're also doubling down on how we're reaching out to farmers to get more food in, more produce, nutrient-rich food in. The more healthy food is, the longer it goes for a person. And so we're pulling all the levers we can to continue to serve these neighbors who desperately need it at this time.
Kenneth, I led this segment talking about that new poll showing 95% of voters believing that hunger is a nonpartisan issue. But in today's partisan world, and you deal with elected leaders, I'm sure, all the time, is that something that you truly notice, nonpartisan issue here?
Most leaders understand the food insecurity issue in this nation. I mean, here in Georgia, 1 in 7 Georgians are food insecure. And that's 1 in 5 children and 1 in 10 seniors. So it's hard to be an elected official and not be concerned with the needs of that many people in our state. So we just count on our neighbors along with us and along with our partners at Feeding America to advocate, to continue to let these leaders know that, hey, this is not a partisan issue. We need bipartisan support and getting the things done that continue to help support our farmers who support our neighbors in need. It's simple, Dan. You can't have a strong food system if you don't have a strong farm system.
You know, Kenneth, our reporter Joe Ripley has been doing a number of stories lately about food insecurity on college campuses. Just ran a story yesterday highlighting Kennesaw State. He was highlighting a food pantry at Emory University last month. And I was stunned to learn that I think it was 2 in 5 college students face food insecurity. Do you find that oftentimes the faces of hunger might be in disguise amongst us all?
It's really eye-opening. I got into this work just about 4.5 years ago, and I had a conception that, yeah, people who need food banks are a certain demographic. It's totally opened my eyes, Dan, to see that people at every level and every stratus in our state and across the country are facing the need of food. And with increasing costs, again, housing in our areas is a significant one. If you're in a rural area, then, you know, sometimes low wages in a rural area or transportation costs that are significantly higher. So every area has their own dynamic, but it all leads to the same predicament that people need support with food.
Kenneth, for anybody watching right now wanting to help, what can they do?
Absolutely. Please reach out to your member of Congress and tell them how additional aid for farmers matters to you, and it helps secure our farm network and help our neighbors in need. There's so much that would be waste in the farm system that we're able to get that donated so that it can go out to neighbors in need. And we need that voice of everyone listening today.
Kenneth, I got to ask you while I still have you here. I'm always fascinated to learn about how artificial intelligence is changing the way we do business in all sorts of different industries. You know, I had heard in terms of food banks, it might be tougher because restaurants are getting more efficient with how much food actually goes to waste now because they're using AI. I mean, how are you finding AI either helping or hurting you in your day-to-day?
Yes, Dan, it is truly a double-edged sword. Not only restaurants, but also manufacturers. We get a ton of our donations from manufacturers who have overruns, and they're getting better and better with AI on knowing exactly what they need, exactly when they need it. So there's less, not that they don't have a heart to donate, but there's less to donate because they're being more efficient. So it requires us to be that much more diligent in getting donors who are not already in our pipeline so that we continue to have enough. 70% of the food that we got this year came from donated sources. So that's a huge piece of the puzzle. So we can't allow AI to impact that, but we can use it to identify people who are not in our system who can be a part of donating surplus food to help our neighbors in need.
There are so many families here in Georgia that are struggling. A new study is really startling. 1 in 3 Georgia families experiencing a level of food insecurity. 1 in 5 report having very low food security, meaning they skip meals, feel hungry, go to bed without eating because of food costs. These are our neighbors, people we love and people who live close to us. It's a really important study that we want to bring in Stephen Patrick with Emory University to talk about. And sir, what stood out to you with this study?
Well, it is striking how affected Georgians are. And particularly, this was focused on Georgia parents with children in their home. And so as you said, we found that 1/3 have some element of food insecurity, and still that's not evenly distributed across the state. What we see is that lower income families have higher rates of food insecurity. Those that make less than $75,000, for example, 44% report some level of food insecurity. We also see that rural families and Black families are more affected in the state of Georgia.
1 in 3 families facing food insecurity seems so high and so startling to me. Can you talk about the seriousness of those numbers?
Yeah, well, it translates into kids and how kids can perform. So what we know about food insecurity is that if you're a food insecure kid, you have a harder time learning. You might be more distractible. And there's some evidence to suggest that being food insecure as a child may have long lasting effects. So I hope, just like your last segment, that this is a call to action for all of us, not just our state legislators, but also for each of one of us in every part of the community. Because, as you said, these are our neighbors and our kids who are affected.
Your data shows that rural families and Black families are hit the hardest. Can you talk about that disparity and what your data shows about that?
So our poll is sampled to be representative of Georgia parents, and it enables us to, with this sample, to kind of dive into the different experiences that different people across Georgia have. And we do see a disproportionate effect of food insecurity. The other thing that we looked at were a couple of things like including SNAP. You mentioned SNAP in the last segment. Almost half of the folks that had SNAP had some disruption in SNAP over the last year. So even when folks are getting assistance, they are struggling to keep it. We also asked about free and reduced lunch. About 14 parents revealed that they had some disruption in free and reduced lunch. So it's sort of impacting all throughout where kids are and where families are.
Yeah, what are the biggest barriers families face when they're trying to become food secure?
So food costs is really driving. So we asked parents, because of food costs, have you cut back on the way you spend? And what we found was about 60% said yes. About 3/4 saying that they were eating at restaurants less frequently. Some changed what they eat, what they buy. So it's costs, and it's being able to sort of do the other things that you can do. So, like the last story about tuition, paying for medicines, paying for rent, paying for insurance. All these things cost money. And so what we see is that for parents in particular, they are skipping meals so that their kids can eat. And even when they do, still some families don't have enough to eat. The other thing that we ask parents about is what about free meals in schools? And almost 90% of Georgia families, parents support free meals in schools. And that is a place where we can really intervene to help have healthy, nutritious kids who can focus in class because they aren't hungry.
Yeah, that makes so much sense to me. What could the long and term impact of this be if kids are going without food, families don't have the food they need to get by?
Well, first we have the immediate effects of not being able to pay attention or being hungry in class. There's some evidence to show that there's mental health issues related to food insecurity. And then as we see that play out long term, the worry is you've not just missed opportunities to learn, but there may be some long lasting even health impacts in some research. So, I think part of this is if we focus in on kids early, if we really put resources towards Georgia's children's, it'll pay dividends for us and healthy adults. And so that investment really needs to begin, again, not just by our state legislature, but all of us can contribute something, whether it's supporting our local food bank or if we're in houses of worship, supporting local schools. School lunch debt is another thing that we measured. About 6% of parents reported some level of lunch debt. We know that meals cost between $2.50 and $3.50, 40 cents if you have reduced lunch. But about 50% of people with lunch debt had $25 or more of student lunch debt, and at the 75th percentile, that kind of top 25%, they had $100 in lunch debt. So we're in this place where we have enough. Just like the last bit on from Kroger, there's enough resources and food out there. I think this issue just flies under the radar for so many. And so I think this is really one of those issues where collectively, whether it's legislative action or action in our communities, we really can do something about it.
Just lastly, you mentioned lawmakers there. What do you want people who are in a position to make policy to take away from this data?
Part of it is universal free meals. We know it works. During COVID and the immediate aftermath, meals were free in school. And that really came from federal funding. USDA created waivers for meals to be free in schools and for there to be summer lunch programs. Well, those went away. So the state can act, certainly, like other states have, to make meals free in schools. And Congress can act too, to create that ability and the funding for states to be able to make meals free within our public schools.
Coyotes in your neighborhood. Have you seen them? They're there, whether you've seen them or not. Let's talk about it right now with Summer Fink from UGA, talking about what you should know. Summer, good morning to you. Thank you for your time.
Good morning. Thank you for having me.
Okay, so coyotes, they are certainly here in Atlanta. I've seen them a time or two when I come into work at like 3 in the morning. But when are they active, and what should folks know about them?
Yeah, so it's funny you say you just saw them at 3 a.m. because that's actually when they're most active is at night. They're really trying to avoid people, so anytime after the sun goes down is when they're gonna kind of start waking up.
And what should we know when it comes to cohabitating with coyotes?
Yeah, so coyotes are wild animals, right? Like we have to treat them like they are wild animals, just like raccoons, foxes, everything. So the biggest thing with living with coyotes is making sure that you are protecting yourself, your pets, and your children. The biggest thing is just keeping your dog on a leash, making sure that you're not feeding coyotes, whether that's on purpose or on accident. So essentially that means like if you're putting out food for a cat, an outdoor cat, the wild animals are also getting access to that food. Coyotes, raccoons, foxes, everything. So just making sure that you're kind of being aware of those situations and protecting yourself.
So if I suspect I might have a coyote den somewhere near my backyard, what should I be doing and what should I not be doing?
So mostly coyotes are trying to avoid us, especially during this time of year when they have puppies. Just like humans, they want to protect their puppies. And in our study, we found that basically compared to what's available to them on the landscape, they were really selecting areas that have a lot of cover, forested areas. So they're really trying to kind of den in spaces where there's not people. But if there is a den that's a little bit close to your house or you're feeling uncomfortable, the biggest thing is just to make sure that your dog doesn't run off into the area that you think there's a den, or you don't venture off into that area, or your kids don't venture off into that area. Just recognizing that they are wild animals, just like us humans, we want to protect our young. They may do that as well. So just kind of avoiding the space that you think that there may be a den.
Summer, tell me a little bit about the research you guys did. It included outfitting a number of coyotes with collars, right? GPS tracking collars here in Atlanta. What did you find?
Yeah, so basically we use the GPS locations from the adults that wear the collars, and then we go to those den sites and we take a bunch of fun measurements, look at what they're denning inside of and where exactly that den is on the landscape. So for us, we found that coyotes were denning in natural structures as well as anthropogenic structures. So it ranged from they dug a hole in the ground to they burrowed inside of a tree, or one time we found like a abandoned boat that was kind of like overturned in the woods somewhere, and basically they just tunneled underneath that. So we saw that they're using a lot of different stuff, whether it was man-made or natural, and as long as there was really no human presence at that space, they're willing to use those dens.
So it sounds like they're able to adapt to urban environments just fine, right?
Yes, for sure. They're super adaptable species, for sure.
Okay, and tell me about the particular season we find ourselves in. By the way, today is the first day of spring. We are 25 minutes away from officially ringing in spring. What does this time of year mean for coyotes and coyote puppies?
Yeah, so coyotes will start to give birth in mid-March to mid-April, and this is way earlier than some of the cities like Chicago in the northern part of the country. So they're actually coming here a little bit early. We just need to be aware that they are going to give birth March, April, and then those puppies will stay really close to the den all the way up until August. So just kind of cautiously knowing, like, hey, there's coyotes around and what we can do to protect ourselves.
That's very interesting stuff. I believe this is like the first research of its kind, right? Is there anything else you want to add about it today?
Yeah, so there was one study done in Canada, but obviously this is the Southeast, some things may be different. Uh, we just wanted to see what was going on. We didn't know very much about the decisions they're making for this critical point in their biological cycle. Uh, and so kind of seeing, oh, actually they are being super adaptable. Actually, they are trying to avoid people, even though it's like sometimes it may not feel that way. They are purposefully trying to be in spaces where there's not people. So yeah, that was some of our biggest findings.
All right, Summer, if folks want to read the study for themselves, where can they find it? And by the way, I have some of the photos pulled up here that's fascinating, so they can go see that for themselves. What should folks be Googling to find it?
Yeah, so for our general project, you can find us on Wildlife Atlanta. We have a lot of resources, conflict-related resources, how to protect yourself, and research stuff. But the paper itself is open access, so that means that anybody can read it, anybody can look at it. It's a little bit more technical, so if you're looking for more of the fun stuff, follow us on social media. But the paper itself is in this article that you're showing, and it's in Ecology and Evolution.
A major investment in Georgia's outdoors is now locked in. State lawmakers approving $1.5 million to finish expanding McIntosh Reserve right along the Chattahoochee River. So this final piece will protect more than 3 miles of riverfront and also expand access for paddling, camping, and trails, part of a much bigger plan now to connect communities across Metro Atlanta and West Georgia. Here to break it on down and tell us what we can expect with this new funding is George Dusenberry, State Director for Trust and Public Land. Glad to have you on with us this morning, with George. So I want to ask you, how big of a milestone is this for McIntosh Reserve?
Well, this is really exciting. Trust for Public Land has been working with Carroll County for a number of years now to expand McIntosh Reserve. This is our third expansion. So it has gone from about 500 acres to a little more than 1,800 acres. And what it does is to the south, we've been able to connect to Chattahoochee Bend State Park, and to the north, we have some Georgia Power property they're going to allow us to activate as parkland. So we have 3 miles within McIntosh Reserve. We're actually talking about an 8-mile section of the Chattahoochee that's protected down there. So we're really excited about it.
Yeah, a lot of people are excited about it too. So for people who are watching or are familiar with this area, what will they now be able to do that they couldn't do there before?
Well, the big thing they can do right now is we built a camp and paddle trail. It's 48 miles. So believe it or not, you can actually put your kayak in at Peachtree Creek in the city of Atlanta and spend 4 days and 3 nights paddling and camping down the Chattahoochee and coming out at McIntosh Reserve. We opened that last year. I'm actually going on a camp and paddle trip myself this May. Looking forward to it. It'll be very exciting. That's the big thing. The next step is actually we were engaging the community around Carroll County, working with the county to do a master plan. We're looking at putting trails in, mountain biking, some more access to the river. And so I don't want to say too much what it is, but you will be seeing trails, mountain biking. I mean, you can already bring some equestrian access down there at McIntosh Reserve, and a new visitor center gateway.
A lot to look forward to. As we mentioned, this all is a result of lawmakers approving this funding not too long ago. So how unique is it for the state of Georgia to fund conservation this way?
Well, actually, about 8 years ago, the state passed something called the Georgia Outdoor Stewardship Act. And so every year, tens of millions of dollars are dedicated to conservation across the state. So this is great. So every year, you see Georgia DNR looking to expand its parcels or make some, the state parks or the wildlife management areas. But it's also an opportunity for organizations like Trust for Public Land or counties like Carroll County to get funding for parks of regional significance. And that's what we have here at McIntosh Reserve. So every year there's a great opportunity. The state makes these really important investments.
Mm-hmm. The Chattahoochee is such an important part of our state. We all know that. But how important is it to preserve the land right along the Chattahoochee specifically?
Well, 30 years ago, the Chattahoochee was listed as the most endangered river in America because of the water quality. And so Trust Public Land actually launched its Chattahoochee program. We preserved 18,000 acres and 80 miles of riverfront along the Chattahoochee. And that does two things. One, it protects the water quality. And the Chattahoochee Riverkeepers done an excellent job with that themselves, but it also provides access to the river. And so we think it's vital and essential. Our ultimate goal is to create a 100-mile kind of linear park greenway along the Chattahoochee from Beaufort Dam, Lake Lanier, all the way down to Chattahoochee Bend State Park.
That's something certainly to look forward to. Before I let you go, George, what do you think is the next big milestone we should be watching for?
Well, we actually are working on building out a 3-mile section of the Riverlands in Cobb County in Mableton and Smyrna, and we should be opening that about a year from now. So we'll have a 3-mile trail. We will be opening the 3rd new park. One is already opened. And we also will be building 2 kayak launches and a boat ramp and some other amenities in partnership with Cobb County and with the city of Smyrna. It's really exciting. So look for that less than a year from now.
County is moving forward with new funding aimed at connecting more neighborhoods and green spaces. This is called the South Peachtree Creek Trail. And joining us in studio this morning to tell us all about it, Tiffany Wills with Decide the Cab. Tiffany, good morning to you.
Good morning. Thank you so much for having me. I appreciate it.
Oh, you're very welcome. So what exactly is this project and what's this expansion going to do?
So this project is just a few connectors in the broader DeKalb County trail system, and the North DeKalb trail system has been very fragmented over the last couple of decades, and Decide DeKalb's board of directors approved a $952,000 tax allocation district award to support the funding needed to complete segments 3 and 5 of the trail system.
Okay, so what are segments 3 and 5 when you say that? What are they actually going to connect to?
So segment 3 is going to connect North Druid Hills Road over by the Target and the Margaret Harris School, and then segment 5 is going to cross over along the Children's Healthcare of Atlanta side pathways and ultimately to Corporate Boulevard on the east side of I-85.
What do you expect people are going to be using these paths for?
Everything. Historically, the North Druid Hills area has really been catered to vehicles, and having these multi-use trails in place is going to allow residents and businesses and employees to be able to cross over on a lot of these very busy streets and parkways by foot and by bike. And so having the multi-use trails is really going to give everyone more access to the community benefits.
I mean, that it is a traffic nightmare sometimes trying to get through that area. And this could potentially alleviate some of that with folks given this option instead to maybe walk to work?
Absolutely. So part of the county's plan, which was comprised of a partnership with Path Foundation, there was a comprehensive study that was done in 2022, and that really has laid the groundwork and the foundation for what we're moving forward with now. So our funding is going to be supporting the design and also the acquisition of really integral components of the trail system, public right-of-ways, and then easements on private property.
Well, we'll get back to more on that in a minute, but you mentioned the Path Foundation, and they just lost over the weekend their founding executive director. I mean, he must have been so proud of how things were going with this.
No, absolutely. And he passed away at 81. He really was one of the co-founding members of Path Foundation in the 80s. And without his vision for Metro Atlanta, a lot of the trails and the regional network that we see today wouldn't have been possible.
You mentioned the price tag on this. Where's the money coming from?
So our award of $952,000 is coming from our Briarcliff Tax Allocation District. And tax allocation districts, essentially, when they're created by the county or the city, they freeze the property-based value in place when it's created. And then as redevelopment occurs and property taxes increase, that difference between the base value and the new value creates a special fund. So it's a really unique tool that we use in Metro Atlanta, and they have them nationwide. They refer to them as tax increment financing. But it's not a new tax on residents or business owners, which is really critical to being able to leverage these funds. And it's really but for the vision of the Board of Commissioners at DeKalb County and Madam CEO to utilize these TAD funds in order to reinvest into the communities.
Lorraine Cochran-Johnson behind you on this project.
Absolutely.
So total costs is going to be about?
For these two segments, it'll be about $2.6 million. So we'll be back to our board in 2028 when the county is procuring their contractors and they have final hard cost numbers. But we're really excited to be able to support this trail, and our TAD funding is actually going to allow the county to use SPLOST funding to finish the remaining portions of this segment.
I want to ask about from a Decide the Cab perspective, because when I think economic development, I think about investing in maybe jobs or big shiny new office buildings, but you're talking about the importance of trails here.
Absolutely.
speak broadly to that from a perspective of economic development and why that's important.
So infrastructure is absolutely critical to economic development, whether that is providing a better community for residents, attracting new residents, or if we're trying to retain businesses that are already operating in DeKalb County or attract new businesses. So when you have major employers and major employment hubs like Children's Healthcare of Atlanta, for example, in North Druid Hills, being able to create and invest in the infrastructure to make access easier is all what economic development's about.
All right, Tiffany, what's the timeline on this, and when can folks finally see some progress here?
So we'll see construction starting in 2028, and we hope to have both of these segments finished by 2030.
Is there anything else you want to add that I'm not asking?
No, we're just excited to be supporting the project, and this is one piece of a larger trail network, and Decide DeKalb is looking forward to be able to support infrastructure throughout the county.